Hello, my name is Dr. Farman Ali and I am a GP family physician. I'm going to talk today about skin cancers. So basically there are three types of skin cancers: basal cell carcinoma, squamous cell carcinoma and melanoma. There are some other skin cancers, but they are rare and we don't need to talk about it in this session. In order to understand the skin cancer, we have to understand the anatomy of the skin itself. The skin is made up of two layers, the epidermis and the dermis. The epidermis again is made up of three further different type of cells. The first one is called basal cells. These are at the bottom layer of the epidermis. And the basal cell carcinoma arises from these cells. The other type is keratinocytes. As the name indicates, they make a keratin, which is the dead material which makes the top layer of epidermis. These cells keep on dividing and dying all the time. However, if this division becomes uncontrollable, we call it cancer. The type of cancer that arises from keratinocytes is called squamous cell carcinoma. We come to the third type of cells, which is melanocytes. Melanocytes are dotted at the bottom of epidermis. They make a pigment called melanin. This melanin goes into the neighboring cells and protects it from sun rays. Melanin causes the skin to become tan in fair-skinned people. Dark-skinned people have a lot of active melanocytes. This is where these cells give rise to melanoma, which is one of the malignant and more aggressive form of skin cancers. Now we'll go through them one by one. So first of all, basal cell carcinoma. This is the most common skin cancer in white and fair-skinned people. Basal cell carcinoma predominantly occurs in older individuals. However, it can occur at any age. Basal cell carcinoma typically develops on sun-exposed areas of the skin, such as the head and neck. It starts basically as a small red, either pink lump, which have a pearly edge to it. Remember the word a pearly edge to it. They grow very slowly and it could take months to grow to a centimeter or more. It forms a certain characteristic ulcer called rodent ulcer, which is a small inflamed crater in the middle, and the edges are again rolled, pearly edged. So what's the treatment for basal cell carcinoma? Basal cell carcinoma very rarely spreads to other parts of the body. Also known as metastasis does not occur in this type of cancer. However, if you leave it untreated, they will grow to the local tissues and destroy the nearby structures. For example, a basal cell carcinoma on the face may destroy the local area, including the nose and other areas. This cancer is curable. Overall, success rate is 95% for the ones which have been present for even a little while. All you need is a small operation or some other methods to remove the affected area of the skin, and the skin removed is sent to the laboratory for further analysis to ensure that it was basal cell carcinoma. The second most common cancer is squamous cell carcinoma. As we discussed, it arises from the keratinocytes. Squamous cell carcinoma is rare in dark-skinned people and predominantly found in fair-skinned individuals. Like basal cell carcinoma, squamous cell carcinoma is also found in older people but can occur at any age. A squamous cell carcinoma typically develops on the face. most commonly around the ears or lips. Initially, it looks like a small crusted or scaly area of the skin with a red or pink base. It may grow into a lump sometimes and give the appearance of a wart. A squamous cell carcinoma sometimes ulcerates and bleeds from time to time, which is at times a distinguishing feature from basal cell carcinoma. Again, the treatment for squamous cell carcinoma is by removing it. A small operation is all that is required, and the removed skin or tissue is sent off to the laboratory to confirm the diagnosis. Squamous cell carcinoma has the possibility to metastasize or spread to other parts of the body. It is also slightly more aggressive than the basal cell carcinoma, and it grows larger and deeper into the nearby structures. If you leave it untreated, squamous cell carcinoma can damage structures around it, such as the nose or the ear. It can erode and completely destroy the nose or the ear. Third type of cancer, which is called melanoma. This is the least common type of skin cancer, but it is more serious. Melanoma is the second most common cancer in people aged between 15 and 34. It is twice as common in young women than in young men. So unlike the basal cell carcinoma and squamous cell carcinoma, melanoma is a disease of the young people. A typical melanoma starts with a small dark patch on the skin similar to a mole. It develops from normal part of the skin, or it can sometimes develop from an existing mole. So how would you distinguish between a normal mole and a melanoma? Remember the A, B, C, D, E of skin cancer. A stands for asymmetry. The shape of the melanoma is often uneven and asymmetrical. So one half will be not exactly like the other half, whereas a mole is more round and even. B stands for border. The border or the edge of the melanomas are often ragged, notched or blurred. A mole has a smooth, well-defined edge. C stands for color. The color or the pigmentation of the melanoma is often not uniform. There are 2 or 3 brown or black colors in it. A mole usually has a uniform color. D stands for diameter. The size of the melanoma is usually larger than a normal mole. As a rough reference guide, 7 millimeters is used as a diagnostic marker. E stands for evolving, which means changes. The changes can occur in size, shape, color, or the elevation, or any such symptoms such as bleeding, itching, or crusting may be due to melanoma rather than a simple mole. The treatment for melanoma, it is important to catch it early. The risk of spread to other parts of the body is high. That is why early urgent treatment is required. The first treatment is an operation to remove the melanoma and some skin in the surrounding area. If it has already spread to other areas of the body, then there is a less chance of a cure. However, the treatment options in those cases are chemotherapy, radiotherapy, or immunotherapy, which may be deployed with varying success. Now, how to prevent skin cancer? If you notice any changes in your skin in the size, shape, or color of an existing mole or a new area of the skin, seek attention early. go to your doctors, get it checked. Take a picture of the lesion and compare it later on with a couple of months, a couple of weeks later. Most skin cancer are caused by excessive exposure to the sun, so it's very important that you protect yourself from the sun, especially in the summer months. It is recommended that if you could stay indoors between hours of 11 and 3 p.m. Cover up with clothes or a wide-brimmed hat when you are out and about in the sunshine. Applying sunscreen with the sun protective factor SP15, SP30 is used for children or people with very pale skin, and this must have a high ultraviolet protection in it. Children should be protected from the sun. Sunburn or excessive sun exposure in early childhood is thought to be the biggest risk for developing skin cancer later as an adult. So stay safe, cover up, apply sun cream, and report any changes in your skin early. Thank you very much.